Okay, I know. We are tired of dealing with viruses. But listen, the viruses are not tired of dealing with us. So we have to talk about what's going on with monkeypox and what's not going on with monkeypox. Now, the virus is spreading fast. Over 7,000 confirmed cases in the U.S. in less than 3 months. And now President Biden has declared it a public health emergency. And despite what you may have heard, listen, people, this is not a gay disease. It's a virus that can affect anyone, even you. So listen up just for a few minutes. You've got questions. I know I've got questions. And we've got the woman with some answers. Dr. Chris Pernell, our favorite public health physician, is back with us. Chris, I'm so happy to see you. Girl, I've got all the questions for you. First, I just want to ask, what exactly is monkeypox? And how did it get here? Why are we dealing with this? It feels like we're living in the end of days.
Morning, Tiffany. So great to be with you today. Monkeypox belongs to a family of viruses. Another type that's very similar to it is smallpox. It's an infection and an outbreak that we characteristically have not seen in the United States. Those outbreaks have been located in regions of Africa, but it doesn't mean that it cannot move across the globe as we are now seeing. There can be transmission from human to human, as well as there has been some transmission from humans and animals. What we're facing right now does feel like a Twilight Zone scenario, but I think the most important thing for all of us to take away from this is the need for public health preparedness in this nation, because once again, we were too slow getting out of the gate.
Wow, that's scary. Now, I want to get into some of the disinformation and misinformation that's been floating around out there. For starters, I just find the reaction very interesting by people I know and in my orbit, because, you know, COVID could literally kill you, especially before there was a vaccine, and people were willing to risk it all. But when you talk about monkeypox and some pimples on my face, wait, time out. How do we get ahead of this? So I think there's a vanity component to people really not wanting to get this. How exactly is monkeypox spread?
So monkeypox is spread by direct physical contact, either with someone who is actively infected or contact with bedding, contact with clothing, contact with an object. We call that fomite transmission of a person who has been infected. Monkeypox can be spread through respiratory droplets, but we do not have clear scientific evidence that monkeypox is spread by aerosols, meaning that it is an airborne infection. So the best way for people to continue to protect themselves is to think about whom you're having direct physical contact with, skin to skin contact, hugging, kissing, cuddling, massaging, and inclusive of sex, all types of sex, oral sex, anal sex, vaginal sex. And so it's really important, as you mentioned, that we don't stigmatize one group, but that we recognize where risk has congregated in which communities, and that we get information out to those people. So no, it is not just men who have sex with men or people who identify as gay who are susceptible to monkeypox. If you have that prolonged skin-to-skin direct contact with someone who is infected, you too could actually get monkeypox.
Now, after, COVID hit us, I have stopped handshaking. It's very awkward when people come and try to shake your hand. But now you're saying hugging. I would always prefer a hug over a handshake. But when you just said hugging, it's like I've just got to walk around in a hazmat suit and stop touching people. What are the tips for not getting this disease? Just some tips that we can all follow. And should we all be rushing out to get the vaccine?
Okay, let's start with the vaccine. No, we all should not be rushing out to get the vaccine, but the vaccine should be more readily available. When you think about the vaccine, it's one of your most powerful tools in your prevention toolkit. Right now in the United States, we're using Jynneos, and that vaccine is a 2-dose vaccine that is right now most eligible for those who have the highest risk category. And the persons in the highest risk category are people who have sex with people of the same sexual orientation. So typically in the United States, we've seen cases predominantly in men who have sex with men, but it doesn't mean that other people are not susceptible. Children have gotten monkeypox because if you live with someone who is infected, you can have that direct human-to-human transmission. Otherwise, do those things to keep yourself safe. Use your hand hygiene. Just know and have conversations with any of your intimate partners. Know and have conversations with anyone who may be having an illness, and do those things that we know are good infection prevention best practices.
All right. Well, that's really good advice. Last question before we go. Monkeypox, can you die from monkeypox? And if you can't, are there long-term effects of monkeypox that can impact your life forever?
Monkeypox is rarely fatal. It doesn't mean that if a person is severely immunocompromised or has a host of chronic health conditions that might put them at higher risk, that they could have severe complications. We have not had any reported deaths in the United States yet, but there have been a handful of deaths of monkeypox across the globe. So I don't want to minimize those experiences, unfortunately, that we've seen globally. But I do want people to know monkeypox is not COVID, but still we have to make sure that we get the most accurate information out to people and that testing is readily available, vaccines are available for those who are at highest risk, as well as treatment for those who are infected.